friends. So for those of you on social, welcome. We're going to be Jaden and I are going to have a great show today on neuropathy. And so we're going to be going live here in just a couple minutes. I mean, we're live with you. You're kind of backstage. So we appreciate that. Appreciate you being here. And we're going to be talking on the radio tonight with some patients who have been dealing with neuropathy. It's going to be a good chat. So any questions you guys have, go ahead and you're welcome to put in the chat. We'll do our best to get to those throughout the show. And yeah, we'll get started. It's going to be amazing. What are you excited about for this show, Jaden?
I'm excited for everyone to hear the stories from other people.
It's Tuesday night. That means it's time for your weekly checkup. I'm Dr. Lazar, and I'm glad to have you in the studio. Jaden, thanks for being here.
Thanks for having me.
One thing I'm super excited about that I have already messed up is I'm not supposed to say it's Tuesday night anymore because our show also plays on Saturdays, and that's super duper confusing. So sorry for the trouble on that. Anyway, we are talking about neuropathy, and it's a big deal. And we've got some callers that are going to be calling in and sharing their experience. So peripheral neuropathy occurs when the nerves in the body, hands, feet usually, are dying. The nerves are dying. And so as those nerves die off, then we have, how do we say, the sensations we have can be really uncomfortable. We can feel numbness, pain, tingling. It can feel like socks are bunched up under our feet. A lot of things. So, Jaden, you are a certified neuropathy tech in the office. And what is it that you have seen that you've been most excited about with the neuropathy program?
I think just seeing how we're changing people's lives in the office, specifically with neuropathy. I mean, we chiropractic care as well. But people who come into our office are told there's nothing that can be done. You can just take this medicine or you can deal with it. And showing people that we're able to help and reverse neuropathy that they're dealing with is just a huge life changer.
Yeah, we're going to hear from some of those people, and it's going to be a great show. So I am completely tied up. You know, we're excited. We've got a new setup in the studio, right? And that's super exciting. We need somebody to like run this stuff though. Like I have such a hard time doing the show and all the effects stuff. And I'm just looking for who's commenting. So Jaden, you keep talking for just a second and I'm going to get this fixed so I don't look like a circus clown.
Okay. So what we do in our office for neuropathy is you come into our office and we would first do a consultation to see if you are a candidate for our care, to see if there's a chance that we could help you. And then we do a couple tests in our office to make sure that you are dealing with neuropathy because sometimes people think they're dealing with neuropathy, but it could be just a pinched nerve or their brain might not be communicating properly to the rest of their body. When we call that, we would call that interference with your body. And so sometimes all you need is chiropractic care or an adjustment specifically to remove that interference. It's not always just neuropathy. So we would check that in our office because we want to make sure that we are helping you and actually fixing the problem, finding the root and fixing the problem, instead of just, of course we can help with neuropathy, but.
Yeah. And it's crazy because people say we can't, or not that we can't, but they say that people can't. So on social, Laura said, good evening. Good evening, Laura. We got to get Jaden on here. There she is. All right.
I feel so low to the ground.
Yeah, we'll fix that. We'll fix that on the break. Hey, if anybody needs broadcasting experience and wants to come like run the tech for us, that'd be amazing. So neuropathy can be caused by several different things. It can be caused by people having an injury to a certain area of the body. Physical injury to your foot can cause that. It also can be caused by medications. It can be caused by infections, injections, surgeries, chemotherapy can cause it. There are a lot of diabetes is a really common thing that can cause that. So it's important to understand what's happening with it. And the simplest explanation is that as the blood vessels get messed up, they don't carry enough blood to the area, and then the nerves starve to death, basically, or suffocate, because they don't have enough oxygen. So that's when we've got to do something about it. So it's a really, really big deal. People will have injections. They'll be on gabapentin or Neurontin. It'll knock them out. They'll be on. They'll take injections. They'll have surgery. They'll be told they have to have their limbs cut off, and it's a scary thing.
A big thing I've heard with patients who are coming into the office for neuropathy, like you said, a lot of them are on gabapentin, and that's difficult for them because you're under the influence when you're on that kind of medicine. So, you can't drive. There are a lot of things that you can't do for your safety as well as the safety of others. And it just really changes and impacts the way that you get to deal with your everyday life. And I think that's almost more difficult than dealing with neuropathy. That's difficult as well, but then to have another thing to think about or thing that you can or can't do,
right,
that would be very difficult.
Yeah, I agree. It's beyond difficult, and why people are told there's nothing that can be done, I don't know, but they're told that.
Prove them wrong.
We're doing it, man, all day, every day. Our number is 866-521-WELL, 866-521-9355. We're taking your calls live tonight. We're going to take a short break, and we'll be back right after this. Welcome back to your weekly checkup. I'm Dr. Lazar. Jaden is in the studio with me tonight, and we are rocking it out. We're talking about neuropathy, and Yeah, we're going to take your calls live. 866-521-9355. 866-521-9355. We're going to take one more short break before we start taking the callers. And we've got just a little bit of a technical difficulty here. We're going to take a short break. We'll be back right after this. Hi, this is Dr. Lazar. All right, so we are back. Dr. Lazar here. Jaden's in the studio. Let's make sure. All right, we are good to go. All right, we're back at it. Thank you guys for your patience. You'd think at some point after this many years we'd get it dialed in, and we do, but then we're like, hey, we can do better. Like, we can reach more and do more and serve more, and so that's what we're trying to do. But we'll get it one of these days. Thanks for your patience. Okay, so neuropathy sucks. That's what we're talking about, and we're gonna take Linda's call. Linda, welcome to your weekly checkup.
Hello, how are you?
Hey, doing well, Linda. Thank you for calling. So
Yes.
what I
Well,
want to
neuropathy.
hear, or what I want people to hear, is your story about what you were dealing with before you came into the office. What kind of trouble you were having?
Well, the spring of 2022 really changed my life to what I thought would be my forever. It was difficult for me to face the challenges and to talk about everything I was going through, but because I simply didn't understand why in 2022 I would fall victim to a rare vasculitis. The vasculitis left me with weakened muscles, severe pain, and eventually unable to walk and use my right hand. Eventually, I would acquire drop foot while laying in a hospital for over a month. I thought my life had ended basically at age 57. I just didn't understand what was happening,
Wow.
and how was I going to be able to live like that? It took me 6 months to get back to somewhat normal after intense physical and occupational therapy and finally making my way back home to Michigan. I had been visiting family in San Antonio when this all went down. Finally getting home with more rehab, more prescription drugs to ease my nerve pain, I decided, enough's enough. I wanted to reach out to get a more natural way of healing, so I prayed about it. And that's when I discovered Lazar's Spinal Care, Dr. Lazar and his amazing team. It's
So,
been well over a year now.
okay.
Mhm. So it's been well over a year now, and the leaps and bounds I've made are nothing less than a miracle for sure.
That's
Last year, June, I was able to join my family in Cabo,
mm-hmm.
feeling confident and strong enough to participate, even outrunning a Pacific Ocean wave. You had to be there to see that one. Then
You
in August of last year, I was even stronger and biked 75 miles in northern Michigan. So I was pretty excited about that. Um, but because I started, to receive adjustments and home therapy under your care.
that's that's insane. So let me make sure that I'm hearing it, like understanding correctly. So you're in San Antonio, Texas, visiting family. So this is supposed to be a fun time, special time. And you start having what kind of symptoms or concerns were you having that made them that you had to go into the hospital?
Well, it really started 6 months before that. Um, I had my suspicions as to how it happened, but it really started in the lungs, a deep, deep, deep cough that nobody could figure out what was happening. I had, they thought maybe I had COPD. I'd never been a smoker. I just acquired this very chronic cough for 6 months.
Okay.
And that, that led me into emergency rooms because I couldn't breathe, was handed an albuterol, saying, well, maybe it's just you have allergies. I live on a farm. I'm an outdoors person. I don't really feel like I had allergies. But I think that was the trigger that triggered something in my system, and everything just fell from there. Um, so I just decided that spring of 2022, I'm just going to go on vacation. Maybe a good vacation will make me feel better, um, you know, get my spirits back up. And it did not do that. I
Right.
got worse. And in San Antonio, I ended up in two hospitals. 1 week in a hospital because I had onset sepsis. I had acute sinusitis, and I had just overall lung issues. And then a month later, I'm acquiring the severe pain in my feet and muscle pain.
Right.
I felt like something was just eating away at my body, and I thought there's something going on. Then I couldn't get up, I couldn't walk, so much pain, and that would land me in the second hospital in San Antonio for a month and a half. Um, After a biopsy of my muscle and nerve, they, discovered I had a rare vasculitis.
And
And
vasculitis, for those of you
that
listening,
led,
is inflammation of the blood vessels. That's what that means. It's not a super specific diagnosis. It's kind of like saying your blood vessels are messed up. That's sort of what that means. Anyway, I'm sorry, Linda. Go ahead.
yeah, no, that's fine. But I had been very healthy. I've always been a very healthy um, person. I love outdoors. I love to be active. And I was always very mindful of nutrition and just staying active, being good to my body. God says to take care of our temples. And I felt like I did that. I had never been in hospitals, only for two births. I never had major surgeries, never a broken bone in my body until, um, and so here I am. It's been it was 2 years in March this year, and still fighting my way back. But every day I'm healing because of the care that I get with you. Um, and I'm excited about that. And I will continue to do that. And I know that I have to give a lot of, you know, credit, obviously, to God for placing me in your hands. And it's just been this route has or journey has just been a supernatural healing for me. Um, the doctors, the team, your guys' genuine care and compassion for people to just heal them. I know God is and has been with me through it all, and I continue to trust His lead and blessing, which is Lazar's final care, and I will continue to receive the care from you until I'm fully healed. But every day I'm getting better.
And then, Linda, I just have one question for you. Would you say, for anyone who doesn't know about the type of care that we're helping you with, would you say that anything that we do at the office is painful or scary, just for those who don't know what we're talking about?
Not at all. I mean, Lazar's final care takes the time to sit with an individual, to just feel them out, to hear their story. They listen, they're that shoulder you can lean on. And they evaluate you. They tell you next steps. They get you on a program or protocol that suits you individually. And for me specifically, it has been the adjustments. It has been the home therapy with the Enlight therapy, the rebuilder machine that I've been utilizing for over a year. I do that at the comfort of my home. When I go in, I've had the beamer done on me, the TRT, the laser. There's so much there that can help people with neuropathy. And these instruments have helped me tremendously. I'm confident with them. There's nothing that scares me about them. The team just puts you at ease. They answer any questions that you have. So no, there is nothing there that I would say would intimidate anybody. It's welcoming for me.
I've heard my jokes are painful, but Jaden
This one
is
included.
Yeah, Jaden is who tells me that. So
But bottom line is that I'm healing naturally, and I have been without prescription drugs for well over a year, almost a year and a half now. But because these instruments are working to help me, for pain alleviation, circulation, reducing inflammation, it's that's what's helping. That's what's helping me. And I'm in my right mind. I don't have to take gabapentin or
sure.
tramadol to ease my pain. And I'm thankful for that because I'm about all natural anyways.
I love that I remember your goal being, I want to go to Cabo with my family. And I know you mentioned you did that, but like that's huge. You didn't know if you'd be able to walk or travel, or had you been to the point, like, had they discussed surgery with you?
No, they
Okay.
did not.
All right. So
It was just continue to get the infusions, which, I mean, I have high respect for physicians, and I just thought, I think I just almost confident. I just knew without a doubt God was challenging me to just go a different direction, and I did. And this is where I'm at today.
So you are, and just, I mean, for, I don't know if credibility is the right word, but you've worked in healthcare most of your career, your entire career, I think, right? I mean,
Yes.
yeah, you've been in
Yes,
healthcare administration for your entire career. So it's not like, you're not aware of what's available and stuff. And it's not even the natural versus unnatural debate. I think sometimes people think we're getting into that. We're really not. We don't care whether something's natural or not just for the sake of being natural. There aren't multiple ways to one end here. If nerves are dying,
that's right.
and blood vessels are dying, you can't out medicate that. So there's nothing wrong with,
That's
stuff that's not natural. Like, it's not bad because it's not natural. Like, my iPhone's not natural. This radio, these radio waves and all the technology we're using, that's not natural. So it's okay if it's not natural. We're not like anti not natural. What we're saying is you can't out medicate nerves dying and blood vessels shrinking. You have to do something. If this is a mechanical problem or a neurological problem, you have to have a mechanical or a neurological solution. You can't have a chemical solution to a mechanical or neurological problem. That's a really, really important point, because otherwise we're just going to keep chasing symptoms, and then we spend $2.6 trillion a year as a nation, and we're not any healthier because of that. That's a different conversation, but it's big.
No, I totally agree with you there. I just knew for me, and to each their own. I highly respect, people's decisions, for their own lives. But I knew that while I'd been going through this, God had been speaking to me about a lot of things, family, talking to me about my career, and talking to me really what was important. And for me, it was God wanted, He was going to be, this right here is going to be my testimony. Because we know that He created all good things.
Right.
And I just knew that, with me going through this, I didn't understand. I thought, why me? But then it was like, okay, Lord, how can you use me in this? It's not poor Linda anymore. It's like, how can I glorify you in this?
Sure.
And it, basically just that, that He does the healing too, right?
For sure. Yeah.
Well,
He does all of it. Sometimes He uses us and sometimes He doesn't, but yeah.
Yeah. Yeah. But I have great respect for the medical field, and it's just what we choose to do. And I choose to heal naturally, and I'm doing fine. I'm rocking it.
I love it. Well, Linda, thank you so much for sharing, and thank you for your availability. We do dinner talks in the community about neuropathy, and we had asked Linda to come share her story, and there just wasn't a dry eye in the place. I mean, she's got a very powerful story, and so thank you for being willing to share that. Any last words before we say goodnight? Or before you say goodnight? We'll be here for a minute.
I mean, well, number one, thanks for inviting me to speak. I appreciate that. And I would just say that for those of you who are experiencing neuropathy, I definitely would not walk to Lazar. I would run there. I mean, you're going to get the best care there. And I know that, the doctors and the chiropractic assistants, they're amazing. They will make you feel comfortable, welcome you. They have become a wonderful family for me. And I know that they can be for you as well.
Well, thank you so much for sharing that. If you're just tuning in, this is your weekly checkup. I'm Dr. Lazar. I've got Jaden in the studio with me, and we're talking about neuropathy. I've had people come in and say neuropathy before, but I knew what they were talking about. So before we take our next call, I want to check in on social. So Laura is sending a message here. She's asking, this is interesting. She said, that she misses driving her car. She misses driving her car. Yeah, if you've got neuropathy and you can't feel your feet, you can't drive your car, you can't ride a motorcycle, that's really, that's tough. So let's see what else we have on here. Yeah, so diabetes, even with diabetic neuropathy, it's we have really great results. People have really great results. Let's see. Want to make sure I'm not missing anything here. Red light. Yes, we're familiar with red light therapy. Laura asked that. There are different kinds, so making sure it's the right kind is really important. But we certainly can talk about that. We've got another one here. Is it Janelle? I'm having a hard time reading it that far. Anyway, my 88-year-old mother used to use gabapentin and suffered terrible side effects. By using a gentle chiropractic approach, there we go, and a more holistic approach to her nutrition, she's seen significant improvements. Her name is also Linda. Well, that's great. That is great. That's wonderful news. I'm glad to hear that. All right. Our number is 866-521-WELL, 866-521-9355. We're going to take our next caller. Gene, welcome to your weekly checkup.
Well, welcome.
Thank you.
I am a patient, and I've been coming to your office for a lot of years, and you've helped me out a lot. And Jaden has been extra special to help me in the office as well.
Did she ask you to say that?
Under your treatment. Pardon?
Did she ask you to say that?
She did not.
Okay.
But, I'm going to collect some money off her.
Yeah, you better.
One of these days. Anyways, I am your patient regarding this neuropathy. I didn't even know what that was. I was going to sleep at night or trying to sleep, and my feet were cold, and they were numb, like they were falling asleep kind of thing. And this was going on for months. And when I was in your office, I'm thinking, what does he know? I'll mention it anyways. And then you started testing me, and then you told me I had neuropathy, and then you showed me these gadgets, if you will. And I said, okay, I'll try them. So I bought them. And I had trouble at first. I didn't quite understand how all this worked. And it took me, after a couple of days, I become acclimated to using that, and it became a routine. You've got to use them. So every morning I would get up and do my reading and so on, and I'd wrap these, I'm going to call them lights. I don't know what they call them.
They're
but
light
I wrapped
boots.
them around my legs. Pardon?
They're light boots. That's correct.
Okay, light boots. So they go about 25 minutes, and they turn on, and then they shut off automatically. And then I'd unstrap them, and I'd go get the bucket and put some warm water in there and spray some stuff in there, and I'd stick them under my feet. I'd go fill up my coffee and read some more and do some work, and that would last about another 25 minutes. Well, I didn't get any results until about 2 weeks, and
Okay.
I just couldn't believe that I wasn't feeling this numbness in my feet. Well, fast forward, I went on a golfing trip up north, and I didn't take the equipment with me. And after a couple of days, my feet started tingling a little bit, not a lot. And I noticed my feet were moving. So I don't have restless leg syndrome. At least I think I don't. And when I mentioned that to you, you didn't even tell me that would prevent restless leg syndrome. So I got back, and I immediately went into my routine again. And my feet are fine. They don't tingle. I sleep well at night. And then aside from that, I use the Beamer, which I bought, and I come in once a week for treatment. I know I'm rambling on here, but it takes time to get used to this.
Sure.
And once it becomes a routine, it's very, very helpful. I don't understand how it works, but it works.
Well, that's a cool story. So you were not aware you had neuropathy. That's what you're saying?
No, I didn't even know what it was.
Because some people know they have neuropathy and are told there's nothing that can be done, that you just have to take gabapentin or Neurontin or tramadol and then get injections and then be in a wheelchair and then have your legs cut off. That's usually so. So you weren't aware of neuropathy. You didn't know it was neuropathy, but you mentioned the symptoms of your feet being cold and kind of numb at night. And you said it a few times, and then, you know, in your visits, we said, wait a minute, that sounds like it might be neuropathy. And then we have a protocol for testing that. So we use infrared imaging to see what the blood flow is doing into your feet. Jaden, you do those, right?
I do.
Yeah. And then other people on the team do as well. But I just had that thought. And then we do a neuropathy assessment and we score it. And anything beyond 20% nerve loss means that this is rapidly declining. And, you know, if we catch it in enough time and have the right all hands on deck approach, we can really reverse it. But we have to address it. We have to address the nerves upstream from where the problem is. We have to address the nerves where the problem is. We have to address the blood vessels upstream. We have to address the blood vessels where the problem is. So it's intense, the things we have to do. But I'll tell you what, actually, I'll let Jaden tell you. How many people complain about it when their neuropathy clears up?
Not anybody that I've heard.
I've never heard it either. So, and one of the coolest things is we have in-office protocols, but a lot of the power comes from the home kits that people do. So Gene, you were talking about your 25 minutes and the routine and that sort of thing. What Gene is referring to are the home kits. And there are people all over the country that maybe can't get into our office, but we offer those. We consult with you remotely. We can send you the remote kits and we can guide you through that. So if you're not near us in Ann Arbor, you can check with us and see if there's another office that knows how to handle reversing neuropathy. If there's not, we're happy. We are happy to help you remotely as well. And that's been really cool with this over the last couple of years, that we've been able to send the equipment to people so they can get the care that way. Because not everybody can come in, you know? So that's
Can I interject something?
Please do.
When I first told you about that, Jaden is the one that tested me. And Jaden, I don't recall all that you did to me. Can you explain to me some of the things that you did in that test?
Yes, so we start with the thermal image that Dr. Lazar mentioned. This will show us where the blood flow is going. And so when we look at an image, we want to see warm colors like dark red. That will show us the proper blood flow. What we don't want to see is blue and purple, because that means in the picture that shows cold, which tells us that there's not proper blood flow going through the area. So that is the first part of the testing. And then the second part of the testing, we use like a hair dryer and like a little, like, not rolling pin, but it kind of looks like that a little bit. And we're testing different nerve endings on both your hands and your feet to see, because not all nerve endings are blocked necessarily with neuropathy. So it can be certain ones, it can be with heat, it can be with something cold. And so we're testing that as well as some nerve scans, 3 nerve scans that will show us more in depth how your body is responding to it, if it's we say in fight or flight. And so that's just an overview of some of the testings that we do.
Okay, that comes back to me, but I do want to say this. I would stake my life on what I'm telling you. I'm telling you the absolute truth here, that for some reason, somehow it works, and my feet do not bother me. I'm able to walk. I'm able to do all kinds of things. They just don't bother me. And many of my friends are complaining about that, but I don't know if they don't want to spend the money or drive to Ann Arbor. I don't know. But you're the only doctor's office that I know that has this equipment to test people. And if they don't come in and get tested, I think they're crazy. So that's my story.
That's pretty straightforward. It's neat. Jaden, you were talking about the different types of tests in the neuropathy exam we do. And that was a good point you brought up. There are different nerve fibers. So some people have a problem with vibration, but not with heat. And other people have a problem with cold, but not a pinprick. And other people, and so that's how we dial in on what nerve fibers themselves are involved. So that part can be really cool. Well, that's great. Gene, thank you for clearly letting people know. And your point that you mentioned about people not wanting to do it. I think if you've been told something long enough, loud enough, often enough, like neuropathy cannot be reversed, even if it's not true, even though it's not true. I mean, it's not an if. We have the data to show. We have the befores and afters. We have the pictures before and after. We have the nerve scans before and after. So even though that's not true, if it's said loud enough, often enough, long enough, people are going to believe it. So I think what you're up against, because we've had these conversations in the office, you and I have, where you've said, hey, I told this person's suffering with it, this person's suffering with it, this person's suffering with it. And I've told them there's stuff you can do, and they don't want to do anything. And I think what's happening is they're just believing what they were originally told, and they're believing it because they heard it so much that they obviously don't believe there's anything that can be done. Because if they thought there was something that could be done, neuropathy is horrible. It's horrible. It destroys people's independence. It destroys their quality of life. They have a fall risk. When you start to lose enough nerve fibers that you lose your balance in the dark or with your eyes closed, that's a really big deal. I mean, you have a fall risk for, at night when you're walking to the bathroom. People have a big issue, when you close your eyes in the shower, when you're shampooing your hair, and then people fall, they can break their hip. 65% of people that break their hip don't ever return home because they have to have surgery and go into rehab and therapy, and then often have strokes and then die from that. I mean, I have 2 family members that happen to. It's so common. So neuropathy itself isn't so much the problem. I mean, it's awful and painful and whatever, but it just keeps going. It just keeps going. Laura online on Facebook said, you feel like you're a prisoner of the disease. That's well said. That's well said. You're a prisoner of a disease. The good news is there's something that can be done. Linda attested to that. Gene is attesting to that. Gene, any final words before you say goodnight?
Well, yeah, I do want to say this. First of all, I have 2 of these apparatus.
2 of the home kits, 2 sets. Yep.
I use them in 2 different homes. Okay, so I don't have to wrap them up and bundle them up and carry them with me. But the important thing is, if you put this apparatus on and you just sit there and stare at the wall, it's going to be a long time. But if you set it up and watch TV or read a book or do your work while your feet are being going through this process, the time goes by very fast. And
sure.
It does for me. So I just wanted to make you aware of that.
That's great feedback. Well, we appreciate you joining us. We're happy for you. I'm glad the neuropathy is reversing. I'm glad you've got the home kit in multiple homes. I think that's brilliant. I'm glad you're on Beamer for blood flow, and I'm glad the restless leg is not progressing and is reversing. That's awesome. Thank you for sharing that.
All right. Thank you. Bye now.
Let me see if I have there. I have an applause thing. There we go. I just had to have an excuse to use that. Okay. 866-521-WELL. That's our number, 866-521-9355. You can call that number. You can text us. I'll just keep it simple. Just call that number. If you're driving or something, I don't want to give you a number to text. But our team can follow up with you. We can set up a consultation in the office. Jaden, how much does that consultation normally cost?
$224.
I asked you because I legitimately don't know the answer. So thank you for knowing the answer. And how much do WMUZ listeners pay for that consultation?
$0.
So if you're listening, if you're wondering if this could help you, take us up on that for sure. You can come into the office for the consultation. We can do a virtual consultation. We can't test you virtually, but we can, still do the consultation, and we can have you come in and we can test you. If you're far away and can't come in, we can send you the home kits. They're not going to hurt you any, it's not going to harm you. So there are options with that.
Dr. Lazar, who's our next caller?
Annette is our next caller. Annette, welcome to your weekly checkup.
Hi.
Thank you for waiting.
doing?
You've been waiting forever. Sorry to keep you on there so long. I got busy.
Well, I'm
jabbing.
actually doing my rebuilder while I'm waiting.
You're doing the rebuilder right now?
Yeah, right now.
That's
Yeah.
amazing.
I just finished my infrared, my booties.
Yeah.
So, my story is a little bit different because I was not diagnosed. I had talked to a couple different doctors. One was my endocrinologist for the thyroid, and she didn't really do anything to even test me. She just kind of went, "No, I don't think you have it." And because I had some worries about some things, and then when I came to you for a different reason, you thought we better test you for neuropathy. So the symptoms I had are different. I really didn't have exactly pain or numbness exactly, but there's a few things I noticed, like when I go to bed at night. Now, I don't know if this part's related, but my toes would just kind of curl up like in like a Charlie horse.
Yep.
And I'm not sure if that was related, but that was happening. And first of all, I had these two toes that went numb, and I'm still not sure if that's related either. But those are some of the reasons I wondered. But then I would be in my bathroom in the shower, and my bath mat began to hurt my feet.
Yeah.
So I told my husband, "Boy, this bath mat is terrible. We got to get a new one because I can't stand on it. It hurts like I'm standing on glass or rocks or nails."
Yes.
So that was a red flag. And then we have rocks in our driveway. And it was very scary for me to walk on the rocks. I felt like I was going to fall down. And it hurt my feet, even through my really good orthotic shoes with orthotics in them. I could feel the pain from the rocks. And my balance is off. So those are the three biggie things that I had. I even bought truck poles. Last year when I met you, about over a year ago, I started to walk with truck poles just to balance myself, make sure I wasn't going to fall down. Because I wasn't going to let this stop me. I have a lot of living to do, a lot of dancing to do, a lot of fun to do.
Heck yeah.
I'm going to do it regardless. Yeah, I have grandkids that I'm 67 now, and I'm praising God for that, and by the grace of God, I'm alive and well. But you've made it, God through you has made it better. I'm praising God for you, your team. You guys are wonderful. You make me feel special. I sometimes feel like I'm your favorite patient. I'm your only patient. Sometimes, I feel like, wow, they really love me here.
We
So I
do.
just wanted to know
We
that.
do. I appreciate you saying that.
Thank you. I really feel that way. I'm looking at my notes. So I do all that stuff. I do have a beamer also, but I did the TRT. And I'm doing the infrared as I've been in the rebuilder. Oh, and the nerve calm you put on the bottoms of your feet at night.
Yes.
I do that.
Yep.
It's a cream. It doesn't hurt or anything. And I'm drinking the drinks, the Neuro Greens and the Neuro Solus. I'm drinking those, which are supplements. And those pills. Those I forget the name of those those little white pills or capsules.
Yeah, I know what you're talking in the nutrient kit.
and I can't think. It's in the Nerve Calm kit. What's that kit? Nerve Coach. And I can't think of the name of those pills, but I take those once a day, 2 of them. So by the grace of God, through you and working on me, and I appreciate it, and my balance is so off, and now I hardly ever use my trek poles. In fact, I'm out there testing it. Even today, I'm out there walking on the rocks and purposely stepping on the biggest rock. You know, I can't feel them through my shoe anymore. They were used to hurt my feet, and I'm not feeling like I'm going to fall or skate around. You know, like how you almost fall and you hurt yourself more sometimes.
Yes.
Almost fall.
Yes.
You know, and you wonder where the person with the camera is to put you on TV.
Right.
You know, anyway, I'm just, you know, so the more I could say more. Do you have I misspoken about anything? Do I have anything wrong?
Not at all. No, it's what we wanted was for you to share your experience because, you know, you'll relate to people that are listening differently than other people would. And so there are people listening who say, oh my gosh, I feel like I step on rocks or broken glass or nails. And other people say, that's weird. I feel like my socks are bunched up under my feet. And other people say, well, that's weird. I feel like I've got marshmallows under my feet. And so really, I mean, literally. So so it's great that you're sharing that because people need to hear that.
Yeah, I did feel 2 things that this kind of snuck up on me. It was like so subtle. And like, you know what I mean? It's like, because I didn't have those other people's symptoms a lot. Plus, I do feel like my toes are kind of wrapped in cellophane sometimes.
Yeah,
not anymore.
That would be connected. And the cramps you talked about would also be connected.
Yeah, that's what I wanted to know. I've never asked that before. Yeah, that's like, you know, and that you can actually see the toes. It wasn't just that you feel the toes doing that. I look at my toes, it looked like a claw.
Yeah.
You know, like a bird's claw, you know, like a big falcon or something. Like, why are my toes? And I have to stand up, get out of bed, stand up like 5 times a night to straighten out my toes. You know, it was like, ow. I thought, do I need calcium, magnesium? Which I did. I started taking that too, but more. But, you know, I think it's related. Like,
sure. Yeah, it is. You're absolutely right. And people don't know that those are related. So I'm glad you mentioned that. Well, we really appreciate you calling in and sharing. It takes a lot of bravery to do that. So we appreciate you being willing to do that. And I know you've helped a lot of people that are listening tonight and that are listening after the fact. So thank you for being brave and being willing to share your story.
I appreciate you guys very much. And I learned from the other people that called their experiences, I'm sure, helping people also.
Absolutely. Well, thanks for being part of the family, and we'll see you soon. Hope you have a great night.
Yes, I do feel like family. Thank you so much. Of
course. If you're just tuning in, this is your weekly checkup. Our number is 866-521-WELL. 866-521-9355. I'm Dr. Lazar. Jaden and I are talking tonight about neuropathy and whether it's possible to reverse it. And we know you've been told that it's not possible. And we say, yeah, right. That's what we say. And so do these callers. Now, these callers are just a couple people. We've got tons of people that have experiences like this. And what we do is we will consult with you in the office. We have a really, 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 really thorough assessment we do. And then if we can help you, we'll put you on a jumpstart intensive care program for it. And sometimes that's stuff in the office. It's always stuff at home, because if you do what's right enough, often enough, you can reverse that as long as it's not too late. So if you're dealing with it, come in and get it checked. You don't have anything to lose other than the neuropathy, other than the pain. So come get it checked. And if we can't help you, we'll tell you that too, and we'll help you find somebody who can. So definitely take us up on that, 866-521-9355. And Jaden, how much is that consultation?
It's normally $224. But to anyone who's listening tonight, if you call and tell us that you are from the radio or WMUZ, that will be no charge to you for your consultation.
That's great. We're going to take our last caller, it looks like, because we're almost out of time. We're going to take our last caller. Jen, welcome to your weekly checkup. Are you there, Jen? There we go. There she is. Hi, Jen. Thanks for calling.
Hey, how are you guys?
Doing well. We're having a blast here talking bad about people doing well. It's great.
I love it. Well, thank you guys for inviting me on the show. And yeah, I just wanted to kind of give my 2 cents about the nerve coach and the treatment for neuropathy, because I think it's important to talk about. And what's interesting is I was actually listening to Annette's story, and it's interesting how many similarities and how many differences we have. When she's talking about the cramping of the feet, I can totally relate, because before I started getting the TRT treatments, I would have instances feet would literally lock. My toes would just pull up and lock. So when she's saying it looks like a claw, it's literally what it looks like. Like your big toe is out, but everything else is up and you can't move it. Like trying to step down and stretch it out, it wouldn't unlock for at least 5-10 minutes. And for a long time, I thought it was just associated to like marathoning and exercising. And then even when I wasn't marathoning, it would still happen. So much like Annette was saying, you know, when you're thinking you're missing some nutrients or whatnot, you kind of start running through the gamut of what am I not getting? What am I not getting? And then you find out it's not necessarily you, it's your body.
Sure.
So my story is a little bit different too. I think that's the thing with the invisible illnesses, is that everybody's different, but we're all the same at the same time. Mine started in 2009 when I was actually out at Lake Michigan. My friends and I were just out on the beach, and I had my pants rolled up, and my friend just says, "What's wrong with your ankle?" And I didn't think anything of it until she said something, and I was like, "What are you talking about?" And then I looked down, and that's when I saw 2 big red splotches right above my ankle bone. And it looked kind of like a rash, but not. They were just bright red. And I was like, well, that's interesting. And it never went away. And then it started spreading over the years between my right foot, and then it started going to my left foot, and then it started slowly spreading up to both my calves, both my shins, up to my knee, in certain spots on both legs, which is like, this is something bigger. So over the course of several years between 2009 and when you started treating me, I had gone to 6 different doctors. I had brought it to their attention, and every single one of them ignored it. The last doctor I went to before I came to you was a vascular surgeon who finally said, "Oh, well, yeah, you've got some disease going on, vascular disease, but there's nothing we can do about it. You'll be fine. Just wear compression stockings, and it's just going to be a lifelong thing." Well, I don't accept that, because you're basically just shoving me out the door. So when I came to you and you said, "No, we've got something we can do. We can try to see if we can reverse it," I thought, okay, well, I was told this can't happen, but we'll try.
And you were told you might have to lose your legs, right? Do I remember that correctly?
Yes.
Wow.
Yes. And like that, I'm 42, and that's traumatizing to hear, when you think you're fine and all of a sudden, oh, well, you're probably going to lose your right foot, maybe your right leg up to your knee, maybe you'll lose the left too. Like,
Man,
that's a lot to process.
that is a lot. That is a lot. Jen, we waited too long to bring you on, and we're out of time. I would love to invite you back to finish your story. We didn't mean to cut you short. We just ran out of time. So forgive me for that. But thank you so much for calling in, and we'll chat. If you think Jen should be back on to hear the rest of her story, leave a comment on social media. We'll take votes for Jen. They all want to hear you. So anyway, thank you for calling in. Listen, we are out of time. This is your weekly checkup. Our number is 866-521-WELL, 866-521-9355. And if you want to have access to that complimentary consultation and see if we can help you with your neuropathy, please give us a call. Have a wonderful week on behalf of our team in Ann Arbor and our awesome team at WMUZ. Have a wonderful week.
God bless.
WMU.
Okay, we are all set. We'll talk to you soon, okay?
Detroit, 103.5 The Light, streaming online.
We're all set, Dr. Lazar. Have a good week.
Thank you, Anthony. You too.